Thank you, Anne. I can't believe that I do all of those things. So obviously, I don't really have a very successful work-life balance by some measures. But actually, do I think I have a successful work-life balance? I do actually, because I love what I do. But what should I think about? Well, this is a photograph of my sister and I often look at it and wonder if my folks could see us now, what would they think? Half a century plus on from this photograph, what would they see? Well, they would see two sisters who, first and foremost, are still good friends. We are both clinicians. One of us specializes in gastroenterology and endocrinology. One likes a little bit of carpentry. We're both associate professors. One likes teaching more than research, and perhaps the other one likes research more than teaching. She deals with small animals. I deal with small people. But we've both made a success of our relative careers. Medicine has been really good to me. It's guided my growth from being a shy medical student who couldn't say boo to a goose and really fainted at the sight of blood, to be honest. It's guided me through my medical student days, through the joys of training, and took me to my consultant surgical post. Medicine, or surgery perhaps, guided my transition from an adult trauma-based practice where I truly thought that fixing calcaneal fractures was the be-all and end-all. But I saw the light and it guided me to the roots of orthopedics, i.e. pediatric orthopedics. Because the word orthopedics comes from orthos and pedia, it means the straight child. And it was Nicholas Andre, a physician, who believed that if you considered strapping and supporting the young tree or the child as it grew, that the child would grow straight as the tree grows straight, and therefore the children could be protected from those orthopedic surgeons who might want to do something a little bit more drastic. And it is in fact that tree of Andre that is the symbol of many orthopedic associations in the country. And what about my guiding influences in this career? Well, Mercer Rang and my old boss, Tony Catterall, taught me that surgery is an art. It's open to interpretation, and that interpretation is based really on the individual, the patient, the family, and the surgeon. So there is an art to surgery. Sorry. But Jim Wright, who I met along the way, also taught me that surgery is a science, that there is evidence, and that it should guide us, but perhaps not totally control us. So we need to know what works for us in our practice and for our patients before deciding what we should be using. And why is orthopedics the career for me? Well, Deepa's going to tell you what the pros and cons are, but for me, it's the absolute perfect mix of judgment, communication, and surgical skills, mixed with continuity of care and knowing what to do, when and why, in order to get the right results in the right patient at the right time. Medicine has guided me through to my coming of age, if you might like, to being actually a president of the European Pediatric Orthopedic Society, to being your guest lecturer here, to being voted trainer of the year by my local training rotation, and in fact, soon to be the BOA president. If my parents could see me now, they would be totally dumbfounded. Did I have any idea that this is the path I was embarking upon? Absolutely not. Do I wonder how I got this far? All the time. Did I do it by following a list of what to do and when? Well, those of you who know me will know that that's not really my style, so I think that that was unlikely. Did I bend and break the rules at every opportunity? No. But did I guide my growth by deciding what I could and should worry about and trying to identify what was not worth worrying about? I hope I did. And I think I've got better at doing that as I've got a bit older. So I can't stress this enough. What you should worry about, first and foremost, is being a good, real doctor, rather than a well-informed but virtual one. I've watched with slight horror the way medicine has changed over the last 12 months. There undoubtedly have been some really good points that we must keep, but there are some bad points as well. If you're going to be a good, real doctor, you must have access to proper patients. You must spend time chatting to them and learning from them. You must know that Ruby and Peter may have the same pathological process going on, but they are not the same. Your clinical skills improve, but only with practice. And there is only so much that you can do on the game box before you have to really see the patients for themselves. You should not worry about those light bulb moments, those sinking feelings, like when I first realized that on the X-ray, the blue arrow pointing to the space between the femoral head and the acetabulum was not filled with space or air or even fluid, but it was in fact filled with cartilage, and that the shape of the bone on the X-ray did not necessarily match the shape of the cartilage. So that if I inject a little bit of dye into the hip joint and outline that space, I find that there was not much space. In fact, the two joint surfaces match perfectly. And what I'm looking at on the X-ray is merely a shadow of what the patient's hip actually looks like. So there's light bulb moments, those sinking feelings, everyone has them. And sadly, I still seem to be having them on a not infrequent basis. You should not worry about what people say you can and cannot do. Personally, I don't think you or anyone can have it all of the time. But actually, few of us truly want that. We don't want everything all of the time. We want different things at different stages, and we want to be in control of what those different things are and when we have them. So prioritization is a skill. We have to juggle our family, our patients, our friends, our hobbies, the team, both at home and at work. And there is no easy answer to how each individual will juggle that. In orthopedics, you certainly should not worry about your gym membership unless that's what gives you a huge, great buzz. It's technique, not strength, that gets you through. I was taught that early on in my career, and every time I started to have the heart sink moment that I may not be able to get this hip back in joint, or that this bone is proving too tough to break. It's technique, not strength, but it does matter having the right help around you. And you must certainly recognize your own limitations, so you should worry about that. You need to find the balance between confidence, i.e. arrogance sometimes, versus lack of confidence. And that balance will constantly change depending on how you're feeling, how the case is going, how your interaction with your team or your patients is going. So an awareness of your limitations maybe, but the balance that you're striving to accept throughout your career is important. I'm not a great fan of books on leadership that you should read, on books on self-help, on management styles. And if I hear the word, there is no I in team again, I will maybe have a pink fit. But there is also that phrase that's coming up these days, there is a flexible me in team. So you need to be the I or the me in the team, be part of the team, bring your individuality to the team, because the whole does become better than the sum of its individual parts. There's a feeling that you should lose the hierarchy, but every good team does have a captain, does have a leader. And I, for one, feel that we should be part of a team, but on each given day, someone needs to be the leader of that team. Otherwise, we might go to pieces. You should think of asking for and listening to advice from others, but who you ask may depend or may guarantee the answer that you are given. So who you ask may depend on the answer you want. And then when you've got the advice, it's up to you to decide whether or not you like the advice and whether or not you want to follow it. Remember that sadly, the advice you are offered may not be in your best interests. If someone comes to me and says, do you think it would be a good thing to come and work for you just now when you've got a spare job going? I am undoubtedly going to say yes, because it's in my best interests to have you working on my team. Whether it's in your best interests is up to you to decide. It may be, or it may not be. And you need to have the courage of your convictions to decide to go with your own idea of what you want to do. Sadly, we are in the middle of a tick box culture. Been there, done that, took nothing in. Done the work, got the higher degree, so what? So for example, research. I'm a great fan of answering a question or asking a question and then answering it. But I don't think you or anyone should be doing research for research's sake or because the boss asked you to. If the boss provides you with a project which has an interesting question and a potential that it can be answered, then that's fun. There is nothing like doing a little bit of research to answer a little question, no matter how small, that might further our knowledge and our understanding. But what you should worry about is having an understanding of research. And I think that's much more important than the actual doing of research. The two go hand in hand, but you don't have to spend three years doing a PhD if what you really, really want in life is to be an orthopedic surgeon. Sadly, I keep remembering what one of my first mentors or bosses said. He said, "Deborah, I think you'd find that if you put a little more effort in, you get a whole more reward out." And at various stages in my career, that's come back to haunt me. Does it mean extending the working day? Does it mean coming in on a weekend? Well, sometimes it does, but it takes only a little more time to review a patient, but it makes you and them feel a whole load better. So I would advocate putting a little more in to get a lot more out. That little bit more in might be extending the working day so that you have a chat in the pub or the coffee shop after the day's work. There's no better place, in my opinion, for debriefing and bonding in equal measure. And it's when you get to know the team and define how you can work well together. Because in this team structure, there is a game to be played if you want to succeed in orthopedic and trauma surgery. There are rules, and the trick is to adapt the rules to suit yourself. Because leadership skills are not always learnt on a course, they're learnt in the real world and working in the team and understanding how you get things done. You must play the game if you're applying for a job. It's your CV versus an anonymized form. And the anonymized forms are undoubtedly a fairer way of assessing some candidates. But you and anyone that I want to work with are so much more than a form that you need to play the game well and have your personality shine through the anonymized form. The game to be played says you can't change a job. Well, why can't you? You can if you have your ideas, plans sorted and prepared. People told me when I got my first consultant post, "Oh, that's it, that's you for life. That's 30 years of your life now sorted." That made me have at least another pint in the bar whilst I tried to come to terms with that fact. So in my career, I've changed jobs frequently and at each time for the right reasons and with the right rewards. I'm going to be the first speaker today, so maybe I can get these slides in before anyone else. Everyone will have their own interpretation of this. In the mid-1990s, because I'm that old, when I took on a consultant post, my appointment meant that 4% of consultant surgeons were women. In 2020, that was up to 13%. Not hugely better, and certainly not much better than last year, but we are improving bit by bit. This is not a good graph. This says that trauma and orthopedics is the worst specialty. But you know, this is historic data because this measures my generation. It does not measure your generation. And the things are changing. So please ignore, don't worry about those figures. Look at these figures, which show that at every level, the percentage women at each grade in trauma and orthopedics in England is improving. We may be losing our core trainees, or maybe they've not quite filtered through yet, but these are changing statistics, and this is your world at the core trainee level, and there is no reason why you will not make the top. Achieving change is tricky sometimes. So I'm not going to come out with some managerial quote on lifestyle or anything like that, but Audrey Hepburn is quoted with saying nothing is impossible, because all you have to do is simply add an apostrophe, and impossible becomes I'm possible. And that's certainly a motto that I've tried to fulfill. So in this challenging, changing world, I like the fact that Great Ormond Street thinks that the child comes first and always. I like that the RNOH believes in excellence in all we do. I like the fact that EPOS feels that we should improve the quality of care of children with musculoskeletal disorders through communication, education, research and advocacy. I like the fact that the BOA believes that caring for patients and supporting surgeons will transform lives. It's an honor to be part of this profession, and pediatric orthopedics is by far and away simply the best. Thank you very much.
Thank you very much, Professor. Those wise words, I'm sure, would be of use for any of us, from medical students up to registrars or even consultants. Thank you.